This video is designed to give you a very brief overview of the Affordable Care Act and how Kronos' Aca Manager Tool can help you with your ACA requirements. As we're all familiar by now, the ACA, very generally, requires that in order to avoid penalties, an applicable large employer must offer its full-time employees and their dependents affordable, minimum value, minimum essential health coverage. An employer is an applicable large employer if it has 50 or more full-time or full-time equivalent employees. And beginning in 2016, there is no more transitional relief for the employers with 50 to 99 employees. Employers with 50 or more full-time and or full-time equivalent employees are required to follow all parts of the ACA. The ACA Manager Tool can be very useful for both, one, monitoring and tracking your employees for compliance with the ACA, and two, the annual reporting requirements under the statute. The ACA Manager, as it is shown in this video, has already been programmed with our demo company's unique health insurance information and employee information. Propel HR provides the setup of the ACA Manager, so this video does not cover the initial setup. What you'll see in the video is how it looks after the initial setup, and the initial setup is done with your unique information. The ACA provides that full-time employees must be offered health insurance coverage. The determination of whether an employee is a full-time employee, or to use the ACA term, a non-variable employee, or a part-time employee, for the ACA that's a variable employee, is an important determination for ACA compliance. The Affordable Care Act defines a full-time employee as one who averages 30 hours or more per week or 130 hours or more per month. The ACA Manager Tool helps to track and maintain this information so that you can easily review employee hours and data. The first step to setting up the ACA Manager is the determination of an employee's status as full-time, part-time, or unknown. On the employee's main page, under Pay Information, the employee status and the pay type information must be completed in the Kronos system and should be reviewed to determine if the information is correct. Next, depending on the information put in the employee status and the employee pay type fields, an ACA profile is assigned to each employee. The ACA profile can be customized by Propel HR for your specific situation, but typically the ACA profile would be non-variable employee, meaning someone hired as a full-time employee, which is 30 or more hours per week or 130 hours or more per month on average, or a variable employee, meaning someone hired as part-time, which is less than 30 hours per week or truly unknown at the time of hire. Once the ACA profile has been assigned, then you can review each employee's ACA timeline to see important ACA tracking information about the employee. The ACA timeline shows the hours worked by the employee, where the employee is in the measurement period, and if there are any compliance alerts. The ACA requires that new and ongoing employees be tracked under a measurement period to determine when and if they are offered benefits. This is especially important for variable hour employees. These are our part-time employees. New variable hour employees are put into an initial measurement period, as you can see here, which is unique to that employee and used to determine if the part-time or variable employee should be offered coverage. Our demo is set up for a 12-month initial measurement period. So at the end of the initial measurement period, the variable employee is evaluated to determine if health insurance should be offered. All other employees are in a standard measurement period, which is tracked on the ACA timeline below. This employee is a non-variable employee. As you can see that this one is in a standard measurement period. We can see that she's no longer in a waiting period because there's no number here, but is instead in a standard measurement period. We can also scroll up from the Aca Timeline to the Aca Summary. This is the Aca Summary for the employee that shows the current Aca status, when the measurement period ends, the average hours in the measurement period, and what type of plan information, whether it's a current benefit plan or whether the plan has been waived, and also the compliance alert, whether there's a compliance alert or not. In addition to the Aca profile needing to be assigned to each employee, a benefit profile needs to be assigned to each employee who has health insurance coverage or who has been offered health insurance coverage. The benefit profile is assigned to each one using the effective date of the employee's health insurance coverage, the date that the coverage was offered. The timeline also indicates whether a minimum value, minimum essential health plan was offered to the employee. This information is added to the benefit plan section of the Kronos product. The benefit plans are set up for all types of benefits offered by the employer. But the health insurance benefit plan has additional ACA questions that are completed related to minimum essential health coverage providing minimum value. The benefit plan also contains the premium information for the health insurance. It is important to make sure that the benefit plan is set up correctly and maintained as the health insurance information changes with new plan year. This information is used to determine if the plan is affordable for the employee. If the plan is not affordable, then the Aca manager will give the employee a compliance alert. Also, if a full-time employee is not offered health insurance at the end of the waiting period, then the Aca manager will give a compliance alert. The compliance alert is an internal checks and balances system to help you understand and make sure that you are following ACA requirements. It is not something reported to the IRS. The system looks to the date of the benefit profile added to make sure that the full-time employee was offered coverage. You can review your compliance alerts and other ACA information by looking under My Reports, Affordable Care Act, ACA Data Summary. All of these pieces, the hours, the ACA status, full-time, part-time, affordable plan, minimum value, compliance alert, all help you to understand what's going on with your employees in connection with the ACA. The ACA profile, the benefit profile, and the benefit plan all work together to provide reports and data that you can use to monitor your employees' compliance. Customized reports can be created in the fields that are most helpful for you. Each of these drill down to the list of the employees' names, and certain notifications can be set up so that you are able to be notified when a variable employee has completed an initial measurement period or when a non-variable employee has completed a waiting period and should be offered coverage. We're in the process of completing short training videos for more in-depth information about some of the pieces outlined in this brief overview. Stay tuned for additional information about the ACA Manager.